All right, we've talked about the behavioral adjustments. We've talked about how to make these changes at the point of performance. But let's also face it, by themselves, they're not enough. Only a third of ADHD children respond enough to those changes to not need medication. And even many of those would still benefit from their medication. But 2/3, and in my experience it's as many as 80%, are going to have to go on medication at some point in life. Maybe it's not this month, maybe it'll be in 6 months, maybe it's a year. Just depends on how compassionate and cooperative the caregivers happen to be, and of course how severe the ADHD happens to be as well. But at some point, these medications will be needed for most children. So I want parents to know them and to know about them. Now, if you're looking for a very good book, the single best book for parents on psychiatric drugs is by Dr. Timothy Willens. Straight talk about psychiatric medication for children. You can get it at the ADD warehouse. You can get it through Guilford Publications at guilford.com. Willens, W-I-L-E-N-S. It is a parent's book on psychopharmacology. Straight talk about psychiatric medication for children. So quickly, let's go over what's out there. Right? First of all, parents need to know we have stimulants. There are only 2 now. We have had them since 1936 for the amphetamines and 1957 for methylphenidate. They've been around a long time, which means we know a lot about them. We know how safe and effective they are. These are the best studied drugs used in pediatrics and psychiatry. So parents need to understand that. We got a lot of information out there on the safety and effectiveness of these agents. But there still is only 2 stimulants. The news in the last 7 or 8 years has been in the delivery systems, because the problem with the immediate release medications is they only lasted 3 or 4 hours. So they had to be given 2 to 3 times a day. So you had to take them at school, and that created all kinds of problems. So companies went back and re-engineered delivery systems to try to keep the drugs in the body for longer periods of time on a single dose. And they came up with 4 ingenious delivery systems called the 5 Ps, which I will tell you about in just a moment. Let's also understand that last year was published the biggest study ever done of stimulant safety for preschool children with ADHD, and they show that the drugs are effective and are safe down to age 2. So the fact that we are seeing some of these drugs instituted younger in life than previously is nothing to worry about. It looks okay. The preschoolers don't respond quite as well. But apart from that, there are no new side effects, and there's certainly nothing life-threatening about using them. The other new agent we have out there is atomoxetine. This is Strattera, approved in 2003 in the US and about a year later here in Canada. Strattera is not a stimulant. It is not an abusable drug. And it is nearly as effective, though not quite as effective as the stimulants. But for some children with particular ADHD comorbidities like tics, anxiety, Tourette's, OCD, insomnia, and so forth, atomoxetine can be a good alternative drug because it doesn't worsen those comorbid conditions. Now, you should also be aware that this August, the US will have a new drug on the market for ADHD. It will be guanfacine XR. Guanfacine XR will be called Intuniv. This is not a stimulant. This is an antihypertensive drug. It has been used for years with ADHD children, especially if they have Tourette syndrome or bipolar disorder or very explosive behavior, because the antihypertensive drug appears to help lower emotional, impulsive behavior in the individual. But Shire has now been able to manufacture a long-acting version of guanfacine, previously called Tenex, and it will be marketed under the guanfacine label. I expect that you guys will probably see it a year or 2 after we get it. Now let's go back to the 5 Ps. These are the new delivery systems. The first P is the pellet system, the pill system, my apologies. The pills are the original forms of the drug. Ritalin and dexedrine are in their original pill form. They last about 3 to 5 hours. So what's new? They put them in a pump. This is Concerta. Concerta is a miniature hydraulic pump, so that when you swallow this, there is powdered Ritalin on the outside of this little capsule, and it goes to work immediately. And then on one end of this capsule, barely visible to you, is a laser-drilled hole at the end of the capsule. Inside the capsule is a methylphenidate sludge in 2 doses, a light dose at the beginning, double the dose in the afternoon. When you swallow this, water is going to come into this upper chamber at a continuous rate, and it's going to push down on this, and like a tube of toothpaste, it's going to squeeze liquid Ritalin out for about 10 to 12 hours. That is really neat. And then the pill is excreted in the child's excrement. So you've got a drug that can last around 10 hours. Some kids it's only 8, others get as much as 12, but about 8 to 10 is about right. That is a really neat system. The next system is the time-release pellet system. So we've got the pill, the pump, and now the pellet. The time-release pellets are what Adderall XR involves, Focalin LA, I think, or XR, Ritalin LA, they're all time-release pellets. And guanfacine XR is going to be the same way. So you have different pellets of medication, in this case amphetamine. They're coated with different time-release coatings. Some dissolve right away, some in an hour, 2, 3, 4, up to 8 to 10 hours. So is there any difference between the pellet system and the pump? Not really over the day, but on the time of day there is. The pellet system is better if the problems are greatest in the morning. The pump system is greater or better if the problems are toward the afternoon or late in the day. But other than that, across the day, they cover about 8 to 10 hours. Excuse me, I want to get rid of that. Okay, hold on. The next P, I don't know if you have this up here in Canada. This is the patch. Okay, this is Daytrana. This is methylphenidate in a skin patch. Wear it on the buttocks, wear it on your shoulder, on your hip, wear it all day long. That's it, it's absorbed through the skin, no taking pills. This is a very hard drug to abuse because you can't snort the patch, right? But there's a problem. About 15 to 18% of patients develop a skin rash to this and can't tolerate it, and it's due to the drug. But 84% of the people can tolerate the skin patch. So it's pretty good as an alternative. Oh, by the way, I meant to mention under the pellet system, one of its advantages is if a child can't swallow a pill and you don't have the patch available, you can open the capsule and sprinkle the pellets on food, like on yogurt or applesauce. Doesn't change the delivery at all. So that's another advantage of that. Finally, last August, we have the first drug of its kind ever produced. This is Vyvanse. It's a form of amphetamine. It's called a prodrug, hence the last P. What is a prodrug? A prodrug is where you take a chemical, in this case amphetamine, and you lock it up. Okay, this is the amphetamine right here, and you lock it up with another chemical so it can't work. Now this drug will only work after you split off, in this case, the lysine. You swallow Vyvanse, there's a chemical in your body that will split off the lysine, and now the amphetamine can go to work. This is the first non-abusable amphetamine ever invented because it only works in the stomach and after it crosses through the intestine into the bloodstream. And that's where the chemical is, the enzyme that splits off the lysine. And now it goes to work. So we have a non-abusable amphetamine on the market in the US. I don't know if you have Vyvanse yet. It's probably coming this year, I believe. Okay. So just be aware that it's down there. Vyvanse is a little better than Adderall XR, which is the other drug made by the same company, and it's replacing it in the US because Vyvanse lasts 2 hours longer than the other drugs do. This is about a 12-hour drug. It also has a softer onset and a softer offset, unlike Adderall. So it's a pretty good drug. I want parents to understand there are misconceptions afoot about the stimulants. They are not addictive as prescribed unless you inject or inhale them. They do not produce aggression, and they didn't cause Columbine. They are, in fact, able to reduce aggressive and antisocial behavior. They do not cause seizures. You'd have to swallow the whole bottle. So even children with seizure disorders can take these drugs safely. They do not cause tics or Tourette's unless you already are prone to tics or Tourette's, and then they may bring them out and make them worse. Even then, only in about 30% of the cases. The remaining cases do not experience a worsening of their tics, and so children with ADHD and tics can take these drugs safely as long as they're not one of the 30% that makes it worse. And by the way, the worsening is temporary. Stop the drug, the tics will go back to their baseline within a week. Are we overdosing ADHD children in North America? Absolutely not. If you look at the prevalence of the disorder, it's 7.5%. If you look at how many children are taking medication, it's between 4 and 5%, which means you are missing a third of all children. And by the way, 90% of all adults with ADHD are not treated. So are we using more medication than ever before? Yes. Is it scandalous? No. What's our problem? We still have people who don't have access to care and who aren't being treated for their disorder. And that's the real problem, as our Surgeon General pointed out, not over-treatment in the United States or up here. Is there a risk of later substance abuse from the stimulants? Your own CBC ran a program on Marketplace. Marketplace? Is that what it's called? Right? The one with that little blonde hottie that used to date your member of parliament? Right? I just want to make sure I got the right program, that's all. Everybody knows when I say that. Oh, her, yeah, we know. Okay. I have a bone to pick with that because they were, in fact, deceitful in their creation of that program, especially with our medical school. But nevertheless, they ran a program claiming that stimulants can predispose children to cocaine abuse, nicotine, and other drugs of abuse later in life if your children took them. This was based upon a single study done by Nadine Lambert in San Francisco. Nadine's study has many, many flaws in it, not the least of which is she never controlled for conduct disorder, which is the biggest predictor of drug abuse among ADHD children. And when you control for that, there is no link between being treated with a stimulant and abusing any drug. How do I know that? Because 17, you can correct this slide, 17 studies, including my own, have now shown no relationship between length of time you take a stimulant throughout childhood and risk of any abuse in adulthood. So there's your box score, 17 to 1. What did the CBC focus on? The 1. Why? Because we all know now that televised journalism is a form of entertainment, not a form of information. That they go after the scandal, the underbelly, the sensational side, and they ignore anything that does not fit that preconceived idea. And that's exactly what the CBC did, which was, I think, a travesty of journalism. Do they improve academic achievement? No, not at the start. But we now have several studies, including one published a week ago, that show that if you stay on your medication at least 2 years or more, we do start to see an uptick in academic achievement skills. But prior to that time, what the drugs are doing is improving your productivity, the amount of work you do. But there's no knowledge in a pill. So why would you know your multiplication tables when you take your Concerta when you didn't know them the day before, right? But what the drugs do is to make you available for learning. And if you stay available for learning over a long enough period of time, you do learn more, but not in the short run. And then I mentioned Strattera. I'm not going to go over that because I've already mentioned it, but it is the non-stimulant on the market right now. And as I said, we will have another one later on. It's a very good drug, especially for kids who have anxiety or tics or OCD or insomnia or other sleep problems. Okay, the next thing I want parents to understand is to avoid treatments that we know don't work or that have a very low probability of succeeding. By the way, if these don't correspond to your manual exactly, I changed a few of them yesterday, okay? I try to keep my slides as up-to-date as possible, or when I go through them and I don't like the teaching, the flow, I may change them a little bit. So if you're not seeing exactly what I have, my apologies, but you've got 99% of what I've been talking about. These are the things to avoid, all right? Why? Because either they're so silly we're never going to look at them, right? Or they've already been looked at and they don't work, right? Taking something out of the diet benefits about 1 out of every 20 ADHD children. We're talking here about colorings, flavorings, and preservatives. Do some ADHD children react adversely to these? Yes. Do most? No. It's mainly children 5 and younger, and it's about 1 in 20. So, do we recommend elimination diets as a blanket panacea treatment for ADHD, as was done by Feingold and others? No. Might it benefit the occasional rare child? Yes. Next, there is nothing you can put in the diet that treats this disorder. So whether it's antioxidants, whether it's the fish oils, whether it's megavitamins, we have yet to find anything that benefits ADHD. The fish oil study, the best one, was published just a month ago by the Swedish research team in Gothenburg. Best trial I've ever seen, and they reported very sobering negative results. Only 25% of the kids responded. It was mainly the inattentive SCT kids. The degree of response was very slight. So even they recommended against it. Any positive reports you've heard were not from well-controlled studies. Now, I'll get to my questions in just a moment. Yeah. Sure. Thanks, Heidi. I'm sorry about that. Yeah. Next, fastest growing treatment in the U.S. school system right now for ADHD is sensory integration training. This is a special set of exercises done by some occupational therapists who have gotten additional training in the SI techniques and in assessing for sensory integration problems. This has been resoundingly disproved. So this is an area that has been studied, but you'd never know it by the number of people being exposed to this treatment. It is proven to be of no benefit for LDs or ADHD. Even their own journal published a meta-analysis that showed that. And yet we go on seeing sensory integration being offered as a special set of exercises to treat ADHD. Why would massaging the head do anything for ADHD? Yet chiropractors do engage in what is called skull massage or neurologic organization training, claiming that they can successfully treat ADHD through skull massage. It's a silly idea. We won't go there. Play therapy has been tested. It does not work for ADHD because ADHD does not arise from environmental stress. So why would helping children cope with stress solve this problem? That does not mean it may not benefit anxious children, PTSD children, or children with depression, but it doesn't benefit ADHD children for their ADHD. Self-control training, I mentioned earlier, this is talking to yourself. So teaching children to talk out loud as they perform a task, we had great hopes for this, and it failed. But the diamond in that dung heap is that we found that it was age-related. The younger you are, the less likely it works. But by late adolescence to adulthood, it does work, but only if you're on medication. It is a supplement to medication, not a form or alternative to medication. There are several books on the market now that were developed by these researchers. One is Steve Safran at Harvard Med School. He now has a cognitive therapy manual for adult ADHD. And the other is by Russell Ramsey at University of Pennsylvania. You could find both of these at Amazon or at the ADDwarehouse.com if you're into adult ADHD treatment. Social skills training should not be done for the average ADHD child unless it's being done at school or with the peer group with whom he is having trouble. And then it should be mostly practice, cueing, and rewarding the use of the skill, and a lot less time spent in training the skill. What's the proportion? 80-20. 80% altering the point of performance, 20% training in the skill. And if you follow that balance and you do it out there where it matters, it might have a chance. If you do it in a clinic with the kids he'll never see again the rest of his life, it doesn't work. Next to the last idea for you, right? 25 to 35% of the parents of ADHD children are ADHD themselves. It used to be people didn't care. They didn't ask. They didn't want to know, or they didn't think it mattered. Now we know it matters. First of all, it matters that your own ADHD needs to get treated because we've studied now the impact of ADHD on parents, whether they have ADHD children or not. We now have a series of studies, particularly the work of Charlotte Johnston at University of British Columbia and Andrea Cronus at University of Maryland, who have now studied parents who have this disorder and what it does to their parenting. And you can see the obvious things here: greater impulsiveness, higher rates of expressed emotion, greater rates of disciplining, lower rates of parental monitoring of children, all of which increases the risk for oppositional disorder in the child. So the parent's ADHD needs to be detected and managed, not just the child's ADHD. And also, more recently, it is the best predictor of who fails in behavioral parent training, is the parent themselves has the same disorder. My last admonition to you is one that Leo Biscaglia wrote about 30 years ago in his book for families of retarded and autistic children. In this book, Biscaglia said one of the most important things a family of a disabled youngster can do is to practice forgiveness. And he meant by this 4 things. You better get good at forgiving yourself for your mistakes. You will make them. We all make them. Even raising normal children, you will make more of them. Because ADHD children know just how to push your buttons to get you to do things you regret. So you better get good at forgiving yourself those mistakes. And if Judy Harris is correct, you don't matter anyway. You're not as important as you thought you were. So relax a little bit. It's okay. You know what really matters, as Biscaglia said? Do you try to get it right the next time? It's not did you make the mistake. It's what are you going to do about it tomorrow to make sure that it doesn't happen again. That's a very important idea. One of the things that I think will be very helpful in helping you to do this, is to step back to that principle about being a shepherd. You're not an engineer. So it matters what you do, but it doesn't matter that much what you do. And I find it's better if you have the shepherd's view because you start to look at your children in a very different light, as things to be enjoyed and celebrated and cherished for their uniqueness, as opposed to being mounds of clay that you can sculpt into whatever you choose to do. You just don't have that kind of power. The second area of forgiveness is that of your child. This is harder, okay? This is harder because resentment can build up. The mistakes are there. The misbehavior is there. You are being given misbehavior 24/7 that you have to deal with. You have had to step up to the plate and become your child's frontal lobes. And it's not easy. It is exhausting. And there's a tendency among some parents to allow a certain amount of resentfulness to creep into this. A wish that you had a different child, a better child, a normal child. And boy, that is just one step away from justifying child abuse. The idea that your child may be doing this intentionally is one of the sources of resentfulness. So you better get good at forgiving these kids their mistakes. They make a lot of them. All right? So here's a couple of suggestions that parents have told me about that work for them. And I love these ideas, and I put them in my parents' book. Number one, at the end of the day, after dinner, when you're having your coffee or your cognac or whatever, I want you to take out a sheet of paper. I want you to write down all the problems you had with this kid today. Write them all down, every one of them, all right? Exorcise your demons. Get them down on the paper. Then I want you to go to the sink, take a match, and light them. I want you to burn them all up. There they go, gone. You have now performed the ritual exorcism. The demons are gone. The day is over. Let it go, all right? The second thing one of the parents taught me that she found was so useful is after your child has fallen asleep, go upstairs, sit on the floor in a yoga position, and watch your child sleep. Just breathe in and out and watch. There is nothing more innocent than watching a young child sleep. And if that doesn't renew your batteries and restore your balance to your view of your child, I'm not sure what will. Maybe a glass of wine while you're watching the child fall asleep. But whatever it takes to let these go and to try to get better tomorrow, that's what really matters, not the mistakes you make. And the same applies to your partner or your spouse. Don't get all upset because they're not doing it quite the way you want it done, or vice versa. And then, of course, the last one is the one you're all here for, I hope, as well, and that is to learn more about ADHD. But in learning, you realize that the public doesn't understand this disorder the way we do, that they are ignorant of this disorder and its causes. So you better get good at forgiving other people who glare at you in Walmart because your child is a handful, who stare at you in the Outback restaurant, who look at you as if this is your fault. My sister-in-law has an ADHD son. This is my nephew, Dan. One time she was in Target, and an older woman came over to her and said, "Why don't you control your child? This is all your fault. If young parents like you would just take this bull by the horns and discipline these kids more, we wouldn't be having these troubles." And she followed my sister-in-law out to the car. At the car, stood there yelling at her while she locked her door, and she was in tears over this. Now, that's an extreme example, but don't tell me this can't happen. Most of you have had these looks thrown at you about your child, and sometimes it goes up a notch. So you better get a thick skin about the public that doesn't understand this disorder. Now, there's a cognitive therapy technique that you can use. While you're looking at these people, you can be saying in your mind, "What's it to you, pork face?" But I don't want you to say it out loud, right? This is just cognitive therapy. You're an idiot. You don't know what you're talking about. If you had one of these kids, walk a mile in my shoes. But just shut up, drive on, get on with your life. But you better get good at forgiving the public their misunderstanding, because boy, do they misunderstand this disorder. I'll hang around for a few questions, but I hope you enjoyed the 30 things families need to understand about ADHD. Thank you.